Here's something that might surprise you. Over half of men in their 70s are still sexually active, and many report having the best intimate experiences of their lives. Yet most men over 60 are still approaching their sexual health like they're 20 years old, and that's actually working against them. I'm Dr. Laura Bennett, and if you're a man over 60 or someone who cares about one, what I'm about to share could completely transform your understanding of male sexual wellness. Today, we're going to talk about something that affects millions of men but rarely gets discussed openly. We'll explore the real science behind how your body changes after 60, why the old approaches don't work anymore, and most importantly, what you should be doing instead. I'll share evidence-based strategies that can actually improve your sexual health, boost your overall well-being, and yes, even reduce your risk of serious health problems like prostate cancer. This isn't about quick fixes or miracle cures. This is about understanding your body's natural evolution and working with it, not against it. Let's start with some honesty. If you're over 60, you've probably noticed that things don't work quite the same way they used to. Maybe it takes longer to get aroused. Maybe you need more stimulation than before. Maybe you're wondering if this is the beginning of the end of your sexual life. Well, I have good news for you. It's not. What you're experiencing is completely normal, and more importantly, it's manageable. The problem isn't that your body is broken. The problem is that nobody taught you how to adapt to these natural changes. Instead, we live in a culture that treats any deviation from 20-year-old performance as a failure, and that mindset is actually making things worse. Here's what's really happening in your body after 60. Starting around age 30, your testosterone levels begin declining by about 1% each year. That might not sound like much, but by the time you reach 60, you've lost about 30% of your peak testosterone. 20% of men over 60 have clinically low testosterone levels, and that number jumps to 50% in men over 80. But testosterone is just part of the story. Your cardiovascular system is also changing. Blood flow to all parts of your body, including your genitals, becomes less efficient due to arterial stiffening and the natural aging process. This means erections take longer to develop and require more direct stimulation. The good news is that understanding these changes is the first step to adapting to them successfully. Why your old approach isn't working. Think about it this way. You wouldn't try to run a marathon the same way at 65 as you did at 25, right? You'd train differently, pace yourself differently, and have different expectations. The same principle applies to sexual health, yet most men never make this adjustment. The old approach was all about speed and intensity, quick arousal, firm erections, intense orgasms, and minimal recovery time. That worked great when your hormones were surging and your cardiovascular system was at its peak. But continuing to chase that same experience after 60 is like trying to force a sports car to behave like a race car when it's designed for comfort and longevity. What happens when you stick to the old patterns? Frustration, anxiety, and often complete avoidance of sexual activity. Many men interpret normal age-related changes as complete sexual failure and simply give up. This is tragic because, with the right approach, sexual satisfaction can actually improve with age. So what should you be doing instead? The answer lies in understanding that your body hasn't stopped working. It's just working differently. And when you align your approach with these changes, remarkable things can happen. First, let's talk about timing. Your testosterone levels are highest in the morning, typically between 6 and 8 a.m. This is when your body is naturally primed for sexual activity. Yet many men over 60 still default to evening intimacy out of habit, when their hormone levels and energy are at their lowest. Simply shifting to morning can make a dramatic difference in your experience. Second, lubrication becomes absolutely essential. As we age, natural moisture production decreases significantly. This isn't just a comfort issue. Inadequate lubrication can cause irritation and even injury. Water-based lubricants are excellent for most situations and are compatible with condoms. Silicone-based options last longer and feel more natural, while natural options like coconut oil work well but shouldn't be used with latex condoms. The key is to stop seeing lubrication as a sign of inadequacy and start seeing it as a tool for enhancement. Just as you might use reading glasses to see better, using lubrication helps your body function optimally. Here's where things get really interesting. The changes in your sexual response that might seem frustrating are actually opening up new possibilities. When arousal takes longer, you have more time to explore different sensations. When orgasms become less intense but last longer, you can experience more sustained pleasure. When recovery time extends, you can focus more on intimacy and connection between sexual encounters. Medical professionals who specialize in men's health consistently report that their older patients who embrace this slower approach often describe it as revelatory. Dr. Stefan Buntrock, a board-certified urologist, explains that the use it or lose it principle applies strongly to sexual function. Men who remain sexually active, even if their patterns change, maintain better sexual health longer than those who withdraw from sexual activity entirely. This aligns with research from major medical institutions. Studies following thousands of men over decades have shown that sexual activity itself promotes continued sexual health. It's a positive feedback loop. Staying active helps you stay capable of being active. One of the most important adjustments you can make is allowing adequate time for arousal. While younger men might achieve full arousal in minutes, men over 60 typically need 15 to 30 minutes of stimulation. This isn't a problem to solve, it's a new reality to embrace. Think of this extended time as an opportunity rather than an obstacle. It allows for more exploration, more variation in touch and technique, and deeper connection with your own body's responses. Many men discover sensations and preferences they never knew they had when they stop rushing toward orgasm and start enjoying the journey. During this extended arousal period, varying your approach becomes crucial. Different pressures, different speeds, different areas of focus. Your sensitivity may have decreased in some areas, but it may have increased in others. Taking time to rediscover your body's responses can be genuinely exciting. Now let's talk about one of the most compelling reasons to maintain sexual activity, your prostate health. This might be the most important information in this entire video, so please pay close attention. The Harvard Health Professionals follow-up study followed over 29,000 men for decades and made a remarkable discovery. Men who ejaculated 21 or more times per month had a 31% lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times monthly. This wasn't a small study or a short-term observation. This was nearly 30,000 men followed for years, and the results were consistent and significant. Australian researchers confirmed these findings with their own large-scale study, showing a 36% risk reduction for men who maintained regular ejaculation frequency. The protective effect appears to work by helping flush potentially harmful substances from the prostate and reducing inflammation in the prostate tissue. This doesn't mean you need to maintain the frequency of a 20-year-old. It means that regular sexual activity, whether with a partner or solo, provides measurable health benefits that extend far beyond pleasure. You're not just maintaining your sexual health. You're actively protecting yourself against one of the most common cancers affecting men. The benefits of maintaining sexual activity extend throughout your entire body. Sexual activity provides cardiovascular exercise equivalent to climbing stairs or taking a brisk walk. For men with healthy hearts, this level of activity is not only safe but beneficial. Research shows that sexually active older men have lower levels of inflammatory markers in their blood, better stress hormone profiles, and reduced risk of cardiovascular events. The physical activity involved promotes circulation, and the hormonal responses help regulate blood pressure and reduce stress. Sleep quality also improves dramatically. 54% of men report better sleep following orgasm, thanks to the release of hormones like oxytocin and prolactin that promote relaxation and recovery. For men over 60 who often struggle with sleep issues, this natural sleep aid can be incredibly valuable. Your immune system benefits as well. Moderate sexual activity, around 1 to 2 times per week, is associated with higher levels of immunoglobulin A, an antibody that helps protect against infections. It's as if regular sexual activity helps tune your immune system for optimal function. So how do you actually put this into practice? The key is adaptation, not abandonment. You're not giving up on sexual pleasure. You're evolving your approach to match your body's current capabilities. Start with the environment. Comfort becomes increasingly important as we age. Make sure you're in a position that doesn't strain your back, neck, or joints. Use pillows for support if needed. If you have arthritis or other mobility issues, find positions and techniques that work with your limitations rather than against them. Timing matters more than it used to. Morning sessions often work better because that's when testosterone levels peak naturally. You also have more energy in the morning before the day's activities have tired you out. There's no rule that says intimate activity has to happen at night. Temperature can affect comfort significantly. Many older adults prefer warmer rooms because circulation isn't as efficient as it once was. Being cold can interfere with arousal and make the experience less pleasant. Physical changes are only part of the equation. The mental aspect of sexuality becomes increasingly important with age, and this is actually where many men over 60 have significant advantages over their younger selves. Performance anxiety affects about 20% of men aged 75 to 95. This creates a vicious cycle. Worry about performance leads to poor performance, which increases worry. Breaking this cycle requires a fundamental shift in mindset from performance to pleasure. Instead of focusing on achieving specific outcomes, focus on experiencing present sensations. Instead of comparing your current abilities to your past performance, appreciate your current capacity. This isn't settling for less, it's discovering different forms of satisfaction. Many men report that sexual experiences actually improve with age because they've developed better communication skills, more confidence in expressing their needs, and less concern about impressing others. The pressure and insecurity that often accompany younger sexuality can give way to more relaxed, exploratory, and ultimately satisfying experiences. If you have a partner, communication becomes more crucial than ever. Both of you are navigating changing bodies and evolving desires. The assumptions that worked in earlier decades may no longer apply. Use I statements to express your needs and concerns. Instead of saying, "You never want to anymore," try, "I've been feeling disconnected and would love to explore ways we can be intimate." This approach reduces defensiveness and opens up productive conversations. Schedule regular check-ins about your relationship and intimate life. This might sound unromantic, but it's actually the foundation of romance for many successful long-term couples. When you can talk openly about your changing needs and desires, you create space for both partners to adapt and grow together. Expand your definition of intimacy beyond traditional sexual acts. Massage, extended foreplay, sensual touching, and emotional connection can be just as satisfying as intercourse, and often more so for older couples. This broader view of intimacy takes pressure off performance and creates more opportunities for connection. It's important to know when changes in sexual function warrant medical attention. Not every change is simply due to aging, and many issues that men assume are inevitable are actually treatable. Sudden changes in sexual function, especially if they occur over weeks rather than years, should be evaluated by a healthcare provider. Gradual changes are normal. Rapid changes may indicate underlying health issues that need attention. Chest pain during sexual activity requires immediate medical attention. While sexual activity is generally safe for men with healthy hearts, it can be dangerous for those with certain heart conditions. Your doctor can help determine what level of activity is safe for you. Persistent erectile dysfunction may be an early warning sign of cardiovascular disease. The blood vessels that supply the penis are smaller than those that supply the heart, so circulation problems often show up in sexual function before they become apparent elsewhere. Addressing erectile dysfunction early may actually help prevent more serious cardiovascular problems. Severe decrease in libido, especially if accompanied by depression, fatigue, or other symptoms, may indicate low testosterone or other hormonal imbalances that can be treated. Blood tests can determine if hormone replacement therapy or other treatments would be beneficial. Speaking of hormones, let's address testosterone replacement therapy directly. While testosterone naturally declines with age, only 10 to 25% of older men have levels low enough to warrant medical treatment. The key is having both symptoms and confirmed low blood levels. Recent, large-scale clinical trials have shown that testosterone replacement can provide modest but significant improvements in sexual function for men with clinically low levels. However, treatment must be carefully monitored because testosterone therapy can affect prostate health and cardiovascular risk. Many men can support their natural testosterone production through lifestyle changes. Regular exercise, especially strength training, can boost testosterone levels naturally. Adequate sleep is crucial because testosterone is primarily produced during sleep. Maintaining a healthy weight and managing stress also support hormone production. Zinc-rich foods like oysters, beef, and pumpkin seeds support testosterone production. Healthy fats from sources like avocados, nuts, and olive oil provide the building blocks for hormone synthesis. These dietary approaches won't replace medical treatment when it's needed, but they can support optimal function for many men. Let's get specific about daily practices that can improve your sexual health and overall well-being. These aren't dramatic interventions. They're simple adjustments that can make a significant cumulative difference. Exercise regularly but smartly. Cardiovascular fitness directly correlates with sexual function. Men who can climb 2 flights of stairs without significant difficulty generally have adequate cardiovascular reserve for sexual activity. But exercise doesn't have to be intense to be beneficial. Regular walking, swimming, or cycling can significantly improve circulation and energy levels. Strength training is particularly beneficial for men over 60. It helps maintain muscle mass, supports bone density, and can boost testosterone levels naturally. Even 2 sessions per week can make a meaningful difference. Manage your medications thoughtfully. Many common medications can affect sexual function, including blood pressure medications, antidepressants, and antihistamines. This doesn't mean you should stop taking prescribed medications, but you should discuss alternatives with your healthcare provider if sexual side effects are problematic. Sometimes, simple timing adjustments can help. Taking blood pressure medication at night instead of morning, for example, might reduce its impact on morning sexual activity when your testosterone levels are highest. Prioritize sleep quality. 7 to 8 hours of sleep nightly supports hormone production, energy levels, and overall health. Poor sleep directly impairs sexual function and desire. If you're having trouble sleeping, address it as a health priority, not just an inconvenience. Reduce chronic stress through whatever methods work for you. Meditation, yoga, gardening, music, or any activity that helps you relax and decompress. Chronic stress elevates cortisol levels, which suppress testosterone and interfere with sexual response. What we're really talking about here goes beyond sexual function. We're talking about maintaining vitality, connection, and joy throughout the aging process. Sexual health is intimately connected to overall health, mental well-being, and quality of life. The men who age most successfully are those who adapt to their changing capabilities while maintaining engagement with the activities and relationships that bring them satisfaction. This might mean adjusting expectations, learning new approaches, or seeking help when needed, but it doesn't mean giving up. Research consistently shows that men who remain sexually active maintain close relationships, and continue to see themselves as vital and capable tend to have better health outcomes across multiple measures. They have lower rates of depression, better cognitive function, and often live longer than their peers who withdraw from intimate connections. This isn't just correlation. There are real biological mechanisms at work. The hormones released during sexual activity support mood regulation, stress management, and immune function. The physical activity promotes cardiovascular health. The social connection combats isolation and depression. If you've been avoiding sexual activity because things don't work the way they used to, I hope this information helps you reconsider. Your body hasn't broken, it's evolved. And with the right approach, this evolution can lead to new forms of satisfaction and connection. Start slowly and be patient with yourself. If it's been a while since you've been sexually active, don't expect everything to work perfectly immediately. Like any physical activity, sexual function improves with practice and regularity. Consider talking to a healthcare provider about your sexual health. Only 17% of older adults report discussing sexual health with their doctors, often because they're embarrassed or assume nothing can be done. But many effective treatments exist for common problems, and your doctor can help you distinguish between normal aging and treatable conditions. Remember that sexual satisfaction isn't just about physical function. Emotional connection, communication, and mental engagement are equally important components of a fulfilling intimate life. Many of these actually improve with age and experience. Here's what I want you to remember from this conversation. Sexual wellness after 60 isn't about recapturing your youth. It's about understanding and embracing your current capabilities while taking steps to optimize your health and satisfaction. The research is clear that maintaining sexual activity provides significant health benefits, from reduced prostate cancer risk to better cardiovascular health and improved sleep quality. But beyond the health benefits, sexual wellness contributes to happiness, relationship satisfaction, and overall quality of life. The key is adaptation, not abandonment. Allow more time for arousal. Use lubrication without embarrassment. Focus on mourning when your hormones are optimal. Expand your definition of sexual satisfaction. Communicate openly with partners. Seek medical help when appropriate. Most importantly, maintain a positive outlook about your sexual future. The narrative that sexual life ends at 60 is not only false, but harmful. Many men report having their most satisfying intimate experiences in their later decades because they've learned to prioritize pleasure over performance and connection over conquest. Your body at 60 has wisdom that your 20-year-old body lacked. It knows what feels good, what matters, and what brings genuine satisfaction. Instead of fighting against these changes, work with them. You might be surprised at what you discover. Sexual wellness truly has no expiration date. With understanding, adaptation, and the right approach, your intimate life can remain a source of joy, health, and connection for years to come. The only question is whether you're ready to embrace this new chapter with confidence and curiosity. Remember, you're not alone in this journey. Millions of men are navigating these same changes, and those who approach them with openness and willingness to adapt are finding that their later years can be among the most satisfying of their lives. Your sexual story isn't ending at 60. It's just entering a new and potentially wonderful chapter.